So there are many states across the U.S., and it's a growing number day by day, that have enacted legislation or implemented legislation for CCHD screening. In New Jersey, the legislation was passed, as I said, in June and then implemented in August. And it was in September that the Secretary of Health and Human Services recommended that CCHD screening be added to the recommended uniform screening panel that is used by states to add to what they're currently screening for. And as currently the majority of states in the U.S. have either enacted or passed or are implementing CCHD screening legislation. Socioeconomic status factors may impact our results. Physiologically, there has not been shown to be a reason that low socioeconomic status would necessarily indicate a greater likelihood of failing the screen, but SES clearly can impact access to prenatal services and ultrasound, and if a certain population would have been more or less likely to have received a prenatal diagnosis, then that would have impacted the proportion of babies that could have been uniquely identified through pulse oximetry. We have gained many pearls of wisdom from our hospitals statewide in New Jersey regarding screening on all levels, but we've also experienced a number of challenges. One specific subgroup of the population that has been subject to some challenges are infants that are in the neonatal intensive care unit. And this has been a discussion that has been nationwide, specifically in New Jersey as well, as to the appropriateness of the current New Jersey recommended algorithm for the NICU population. We are excited that we're currently embarking on a study to study this population more specifically and try to identify whether there are factors that could influence and possibly form a modified algorithm for the NICU population, such as whether the timing of the screening should be specified and different, whether prematurity, for example, could be an indicator such that extreme premature infants wouldn't necessarily need to be screened. So we're hoping in New Jersey that that will inform our rules and regulations and writing of that to help the NICUs in the state do the screening, implement it appropriately. We also have a number of other states nationwide that have similar questions and that are joining our study as well. So we're excited to gain the data and help inform our rules and regulations. I'd like to add our appreciation for the nursing staff and the hospital's response to the screening. It was a quick turnaround for rapid implementation, and evidenced by the very high proportion of infants that were screened shortly after implementation speaks to the hard work and the efforts of our staff at our New Jersey hospitals. Being a statewide mandate and screening every newborn can surely be challenging, but our staff, our nursing staff, and our hospitals rose to the occasion and not only implemented for the babies across the state, but also were quite instrumental in providing the Department of Health data to evaluate the screening program. And that has really been key for other states and leading the charge in providing data to help inform other states, but also the national and state discussion as to the effectiveness of the screening.